तो अभी तो धन्वंतरी जयंती में कार्यक्रम ऑल इंडिया स्ट्रीट में है, यहाँ पर दिल्ली में देखिए शायद मोदी जी आने वाले हैं उसमें।
हो मोदी जी आने वाला है।
फिर मोदी जी आएंगे। हाँ, ये धन्वंतरी जयंती पर है प्रोग्राम। संभवतः शायद मोदी जी आए, अभी तो राष्ट्रपति भी आए थे यहाँ।
हाँ, ओके।
ऑल इंडिया विश्वता विहार वाला जो ऑल इंडिया है ना, वहां
हाँ।
पर मोदी जी वहां में देखिए अगर क्या होता है उसका अभी सूचना तो हम लोगों के पास नहीं है कोई। हो सकता है जाए हम लोग आज।
Sir, I will start with the introduction. Sir, शुरुआत करेंगे। Namaste, very good afternoon. Sadar pranams to all the respected dignitaries, governing body members of RAV, our Gurujans, Shishyas, and all other Ayurvedic scholars who have joined us today for the 190th episode of Gyan Ganga, a Knowledge Warrior weekly webinar series. Today, our guest speaker is one of our gurus, Dr. N. Narayanan Namboothri, who is going to discuss on the significance of Panchakarma in Netra Rogas. I, Dr. Pooja N., on behalf of Rashtriya Ayurveda Vidyapeeth, welcome you all for today's session. First, I would like to express our heartfelt gratitude and welcome all our mentors who have always been there to guide, motivate, and encourage us for the sustenance of this series. Respected Padma Bhushan by the Sri Devendra Trigunaji, governing body member. Ji sir. Respected by the Sri Rajesh Kotecha sir, Secretary Ministry of Ayush. Respected Director Vandana Siroha, Dr. Vandana Siroha, Director Rashtriya Ayurveda Vidyapeeth. I thank them all for their constant support and guidance. Let us begin the session by seeking the blessings of Lord Dhanvantari. Namami Dhanvantari Devam Surasurairvandita Pada Padmam Loke Jararubhaya Mrityunasham Dataramisham Vividhaushadhina. Next, I would like to introduce today's expert, Dr. N. Narayanan Namboothri sir, who is going to throw light on the significance of Panchakarma in Netra Rogas. Sir is the Chief Physician at Sridhariyam Ayurvedic Eye Hospital and Research Center at Ernakulam. He has more than 30 years of experience and expertise in treating a range of ocular conditions and a track record in healthcare administration. He has completed his BMS in 1994 from Venkatramana Ayurveda Medical College, Chennai. Further pursued his master's in Manasaroga from SDM Ayurveda College, completed in 2010, and ongoing is his PhD from Mansur Institute of Ayurveda Education and Research Center. He is the Chief Physician and also the President and Director of Sridhariyam Ayurveda Research and Development Institute and Director of Sridhariyam Farm Herbs India Private Limited. He has various publications and achievements to his name. To name a few, the recent achievement was Vamsavaidya Awards 2022 by Shri Hospital Group and Ashwini Award in 2011 and 2019 by SDM College of Ayurveda. He has presented papers in national and international seminars and also been a resource person for various programs. He's in Sridhariyam is also an institute where the CRAV course of RAV is being conducted. With these few words, I humbly welcome sir for today's session. I welcome you, sir.
Let me start. Namaste and warm greetings to this esteemed gathering of CRAV scholars, Ayurveda pioneers, and honored guests. I am deeply grateful to Padma Bhushan, Padma Shri, Vaidya Devendra Trigunaji, President of Governing Body RAV, and Dr. Rajesh Katojaji, and Director Ayush, and Dr. Vandana Shiroha Madam, Director RAV, for bestowing upon me the privilege of sharing my knowledge with this distinguished audience today. And Dr. Pooja for her efforts in coordinating this event. Through this presentation, I would like to emphasize the importance of Panchakarma in Netra Chikitsa. Om Sri Guru Bhyo Namah. He is Dr. NPP Namboothiri, my Guru, and earlier CRAV Guru. Also, he was the director and founder of Sri Dariyam Ayurveda Hospital and Research Center in Kerala. And today, my topic of presentation, it is Panchakarma in Netra Rogas. I'm not planning to deal in detail about all the Panchakarmas, but which is significant in the management of Netra Rogas, that only I am planning to deal. As you all know the Basti, Virejanam, Vamanam, Rektamoshanam, Nasyam, these are all the Panchakarma procedures. Iha Vamanadishu Karma Lashanam, Bahu Adi Kartavyada Yogi, Dosha Nirkarana Shakti Jaya Twam. Bahu Idi Kartavya. So the Shodhana therapies, it has got a broad spectrum of action. It's bring the doshas from the chakas to the koshta and eliminate from the koshta. And from the urdhajatru also the doshas which is lodged in the deep inside, that is bring to the nasal orifice and bring expelling it out. And dosha nirharana is the main aim of this Panchakarma procedure. Vamana, Virejana, Basti, Niruha, Anuvasana, and Nasya, Rektamoshana are the Panchakarmas which we are following the Ayurvedic physicians. In Panchakarma, all the Panchakarmas, there is some Purva Karmas and there are some Paschat Karmas also. This Panchakarma, it is Pradhana Karma. As far as the Netra Chikitsa are concerned, the Purva Karmas and the Paschat Karmas are also so significant. The Purva Karma, Pachanam, Snehanam, Swedanam. In the beginning stages of all the Netra Rogas, Pachana Ushadas or Lankanam, that is the first thing advised. And if with that, if it is not subsiding, Snehanam and Swedanam, and which all the doshas, it is travels from the kostas to the shakas and also to the urdhajatru, that to bring back to its original place and eliminating from that area. And later on, Samsarjana Kramas, Samana Ushadas, Murdha Dailas, and Kriyakalpas are also doing in almost many of the Netra Roga Chikitsa practice. And it is significant not only in Netra Chikitsa, it is mentioned in the Ayurveda Shastra, it is put in Kaya Chikitsa aspect, Kaumara Pratya aspect, Shalakyatantra aspect, Shalya aspect, Kaya Chikitsa, Shodhana, it is one main line of treatment managing various conditions in multiple srotas. Vamana, it is advisable in the Kaumara Pritya management. In the Amarjata Shishu Parijaya, it is mentioned. And in Shalyadandra, we are administering this Panchakarma procedures as a Purva Karma of Ashtavida Shastra Karma. In Shashti Upakramas also, Shashti Upakrama of Vrna also, it is mentioned, all these Panchakarmas are mentioned in Shashti Upakrama of Vrna Chikitsa. In Shalakya, Shodhana performs Samprapti Vigadana by preventing doshas from circulating upwards into the Shiras and Indriyas. If in the early stage itself, if it is possible to eliminate, it is good thing. And in Nasya, that helps to eliminate the Urtha Jatrugada Kapha doshas. And in Paitika conditions, vitiated Rakta, it is eliminating it through Rakta Moshana, either in the Jaluga or Siravyatham or Lekhana procedures, etc. can be used. And even in the Manasaroga Vigaras. And it is the first and important treatment mentioned in the management of schizophrenia, bipolar mood disorders, personality disorders, Unmadam conditions. The Virajana, it is the Agriya treatment in the management. Usually, Avipattikara Churna is using it very good effect. And another comes Rasayana Chikitsa. Shodhana Karma is the Purva Karma of many of the Rasayana therapies. Administration of Naimittika and Vadadivya Rasayana before doing the Panchakarma to be done. In Vajikarna Chikitsa also, Shodhana plays a big role. The Mandagni, that is the cause for all the diseases. And that Mandagni leads to Amatva. If Ama persists, Ama and the dosha Urtva Gamitvam will be taking place. And that Urthogami doshas to be bring back to the Koshta. Panchakarma resolves the Ama and that returns the body to proper physiological activity. And it helps to arrest the movement of doshas from, it helps to create the dosha, the movement of doshas from Shakha to the Koshta. And without the doshas bringing from the Shakha to the Koshta is eliminated through proper expulsion therapy. Doshas managed with Lankana and Pajana reoccur, but which it is treated with the Shodhana therapy, it should not reoccur. So it is not reoccurring, so everyone require the treatment which will not reoccur it again. Should be done before Kriyakalpa. There are Kriyakalpas mentioned in Shalakidandra, such as Tarpanam, Pudavagam, Anchanam, Ashtodanam. It is main treatment for Netra Chikitsa. But before doing the Netra Chikitsa, the Panchakarma procedures so significant before the proper Shodhana. If the patient is healthier enough to adapt, accept these procedures, then only one can introduce this Kriyakalpas. Netraroga Samprapti normally Prakupita dosha Pitta traverse the Urtha Siras and settle in Netra and Vatma, Santi, Sukla, Krishna, Drishti, Gada Rogas are manifesting. The aim of the Panchakarma is to Samprapti Vikadana. Prakupita dosha in the preliminary stages, the Amapajana Trivyas can be given. When it travels the Urtha Siras, need to bring it back. Some Snehana Trivyas to be given. Shodhana therapy can be given. With that, the things will come to the kosta. And if with that also, if it is not happening, if the doshas further aggravation and it is going to the upward siras that settle in the Urthajatru, the netra, not only in netra, in the karna or the nasa, wherever the problems it is happening, pain, hearing loss, drishtinasham, development of kacham. That means drishtigata rogas and sarvagata rogas are developing, and prevents the dosha from the upward movement is the first thing to adapt here. There are stages of pragubhita dosha. Amapayachana is one thing to be adopted. And next thing, the Urthvajatru Prasruta Virejana can be given. In Sthana Samsraya, Nasya can be given. In Amapajana drug in the Netra Chikitsa, drugs like Segam can be adopted. So Amatam in the Netram, in the Netra Sandhis, Pashma Vatmagata Sandhis. In that condition, one can start Triphala Ishtimadukada Sukada Swegam, Triphala Kashayam Segam, Lobdha Ishtimadu Kashaya Segam, and Avagundana can be given with the Tulasi Patram and Haridra. Ashchodhanas can be given, and orally the Samana Ushadas like Amurdotaran Kwadam, Uduchadi, Panchakovalam, Sudarshana Gudiga, Shadharna, etc. can be given. The Virajana Aushadas like Nimbamurdadi Erandam, Gandharavastadi Erandadam, etc. can be given in Vada aggravated condition. Abhibhatti Karachurna can be given in Pitta aggravated condition, and Tripurtalehyam can be given in Kapha aggravated conditions. Samana Nasyas like Anudaila or Shatbindu Daila can be given in the Urdhva Yatru conditions. In some other Brahmana Nasyas like Kshirabala Dailam or Jivantyadi Nasyam or Dhanundaram Avarti Nasyam can be given in Netra Rogas. There are some contraindications also there. That is the common contraindications mentioned in the Panchakarma, Bala. So young, we are not supposed to do all the Rektamochana or Nasya or all those things. But in Navajada Shishu Parijaya, Vamana it is mentioned. And in 2 Krisha patients, for the better strength of the spine and neuromuscular system, the Tailabasti or Matrabastis can be given. In Vriddha patient, this Panchakarma, it is not so advisable. In Stula, it is not advisable. In Krisha, it is not advisable. Those who are affected with some accident or Kshata, those people, because of the restricted mobility and pain in the area where it is affected, deep thinking is required to adapt this Panchakarma procedures. And also those who are affected with the cardiac problems, Hridrogi. Many of the Hridrogis coming with a lot of intake medicines. In those conditions, if too much of Snehana therapies cannot be given, too much of dehydration procedures also cannot be given, and we can restrict without too much of dehydration, we can restrict the medicines also. But even then, there is a lot of risk factor is there. So understand the risk factor of this Basti or Nasya or Virejana in the Hridrogi, and also Durbala patients. Also, it is not so advisable. We need Brahmana Chikitsa. Significance of Purva Karma, Amavastha. and Niramavastha are the two avasthas. In Amavastha, the Pajana Aushadas, Deepana Aushadas can be given. Pajanam, Swedanam, external application of lepas, Tikta, Annam, Dhumam, etc. can be given. And Deepana Aushadas can be given in Amavastha condition. When Amavastha goes and reaches to the Niramavastha, there we can start with the Snehanam. And that Snehanam also, which it is so good for the eyes, Chakshushya, the Kridas like Padoladi Kridam, Diktaka Kridam, Mahadiktaka Kridam, Kalyanaka Kridam, what kind of Kridas can be given. And the Swedana, that also not too much of Rucha Sweda, and the medicines putting in the Swedana Kashayam, make sure the medicines it is of Tikta Kashaya Pradhana Aushadas. Snehana, Drishtigata and Sarvagata Rogas, Timiram, Kajam, Abhishyandam, Adimantam, Sushkachivagam, etc. Snehana can be given the medicines like Jivandyadikradam, Trifalagradam, Padoladikradam, Maha Trifalagradam, Maha Kalyanagradam can be given. In Vada, Kapha, Abhishyandam and Adimantam, Abagundana Swetam can be given. So these Purva karmas are also treatment in the management of many of the eye diseases. Importance of Purva karma. Shaka Gada doshas get excited by Snehana, travel to the Kosta for the proper, already I told you, and opening the Srodhas. Virajana, it is indicated in Paitika Vikaras, Adobhaga Shodhana, expulsion through downward track. It helps Samprapti Vikatana, prevents the Urdhva Prasada of doshas. If that Urdhva Prasada happens, that lodges in the Urdhva Jatrusiras, that to bring back to Kosta, and this Virajana can be given after the proper Snehapana and after getting a Sambyak Snigdha Lakshana to the patient. It is indicated in Akshivagam, Daham, Netrasravam, Timiram, Linganasham, Adimandam, all the many other conditions. This Virajana is advisable, and that helps to restoration of proper physiological activity to the retina and the eyes, and thereby improving the proper vision. Some of the Virajana yogas are like Avibhattigara Churnam, that is Kapha, Pitta, Haram, Rakta, Dushya Haram, Samshodhanam, and Virajaniga. Triphala Churnam, it is Rasayana, it is Chachushya Rasayana, and Rakta Doshahara, Srodo Shodhana, Kleda, Srodo Shodhana, Kleda Haram, Erandadelam, it is Vada Kaphaharam, Sonida Vigaraharam, Srodo Shodhanam. Padola Katugaronyadi Kodam can be given in many of the inflammatory conditions, uveitis, other retinitis conditions. Padola Katugaronyadi Koda with the Kaisora Gulgulu we can give. And then Trivurtilekya, it is Pitta Kapha Samana. It is Sukha Virajaniga and it is Lephana in nature and Sroto Shodhana. The Manipatra Guda is advisable in the same as I told you in Paitika and Rakta, Medo, Dushti, Janya Vigaras, it can be used. It is Anilomana, but while giving the Manipatra Guda or Trivurtilekya or Padola Katigironyadi Kashaya, one should make sure the dose it is sufficient enough to get a proper virajana. 60 ml of the padam is not sufficient enough to get a proper virajana. Need to give more than 100 or 120 ml of kashaya. Trivurthalekya also or Manipatralekya also, near about 20 to 25 grams of medicine is required at a moment. Then only the proper virajana we can expect. Erandadilam also it is like that. Minimum of 30 according to the Koshtabala, one should decide the medicines. The Triphala Churnam, its combination and that is Haridaki, Vibhidaki, Amalaki. If the Haridaki quantity, if it is more, the 3:2:1 ratio, that gives a good virajana. If it is of equal quantity, it is Chakshusha. And for better virajana, Haridaki should be of more of quantity. Bastis. It is Agriya treatment for Vadika conditions. Astavanam and Anuvasana are Bastis. Role in Urdhva Jatru Vigaras alleviates abnormally lodged Vada from the Urdhva Jatru. Exclusively indicated in Netrarogas, Shirorogas, etc. And predominant dosha Vada, but can be used to manage other doshas also. And those indicated for Niruha are also indicated for Anuvasana Basti also. And it improves the neuronal and muscular activities to the eyes and enhance the movement of the ocular structures. So due to the Vada Vaigunyam or because of the Anubandha of Pitta or Kapham, in many of the cases ocular movement is restricted and facial muscles are weakened, facial nerves are weakened. In all those conditions, after giving a proper snehana, first with Divana Pajana Aushadas, then snehana, and then Basti, Taila Basti can be given first, and then depends the health of the patients. According to the status of the Roga, one can decide about to give Yoga Basti or Karma Basti or Kala Basti. Improves retinal health by nourishing all the dhadus and nourishes and lubricates eyes. And it nourishes the dhadus and the property of the medicines which we are using is that to enhance the good nourishment to the Urdhvajatrus kind of medicines. Jivaniya Aushadas, processed with the Jivaniya Aushadas, processed with the Dashamula Kshiram, Dashamula Siddham, or Lahu Panchamulam. And retinal health improvement and all the Chakshusha Aushadas are processed and make into Sneha, and that to be used for the Basti purpose. And nourishes and lubricates the eyes, and that protects the eye from degenerative, inflammatory, and genetic disorders. In degenerative conditions, something which is of regenerative action medicines can be used. Mustadi, Kashaya Basti, Mustadi, Rajayabana Basti. And inflammatory conditions, the Basti, which it is made of Padola Muladi Kashayam, Padola Kadavirovanyadi Kashayam, or Mahadiktaka Kashayam, in that Kalkam, with Yashtimadu Kalkam, Triphala Kalkam, Lothra, Yashtimadu, Vasha, Triphala Kalkam can be used. In genetic disorders, also as earlier I told you, the Rajayabana Basti or Balagulichadi Brahmana Basti can be given in many of the genetic conditions also. Already told you Mustadi Rajayabana Basti. And the Shodhana Basti is indicated for the purification of the body. And the metabolic and autoimmune disorders, it is advisable. And in Prameha and Prameha Janya Netra Rogas also kind of Shodhana Bastis Chodana Bastis, in Pramehajanya Nether Rogas. Basti, the entire Basti, the as such it is not required, but in the form of enema, we can make Uduchadi enema with the Triphala Churna Kalkam mixed with the Guluchadi Kashayam and filtered that to be given enema in retinopathic conditions and also in some other autoimmune conditions. It is very helpful in the management of many of the autoimmune and the inflammatory conditions. And the drug selection, it is according to the nature of the patient and the nature of the disease. There are some Basti yogas I am planning to explain. This is Ardha Matrika Basti. We can use this as Purna Matrika Basti also. And here the dose of ingredients are Matchigam 100 ml, Levanam 515 gram, Sneham 100 ml, that with the Padavaladikirdam or Madhyashtiadi Dailam or Shirabala Dailam, Kalkas like Yeshtimadu Kalkam, Vaiswanara Churna Kalkam, or Kwadas like Dasamula Kwadam or Vashagulichari Kwadam can be used. And as I told you, this Padavaladikirdam or Madhyashtiadi Dailam, all the medicines is not required in one Basti combination. Either Padavaladikirdam or Madhyashtiadi Dailam or Shirabala. Either Yeshtimadu, Vaiswanara. And Kashayam also, the Samula Kashayam or Vasagulichadi Kashayam or Uluchadi Kashayam. Padavaladikirdam along with Yeshtimadu Kalkam and Vasagulichadi Kashayam can be given in the condition of retinopathy conditions, in glaucoma conditions, in other inflammatory conditions, in other degenerative conditions. We can use Triphala, Ksheerabala Thailam as a Sneham and Vaiswanara Churnam as a Kalkam. It is Vaiswanara Churnam taking, it is Kaphavada Shamanam and it is Anulomana in nature, it is Deepana in nature and it is Srodoshodhana. And Vairejanika property also, that is already mentioned, Anulomana is there. And Kaphavadaharam, Shamanam. It is indicated in Akshibhedam, Vatmagada Rogas, Vatmastambanam, Akshishulam, Timiram, Vadaja Abhishandam, Vadaja Adimandam, Akshi Vita, and many other ocular conditions it can be used. Other thing, it is Guduchadi Yamanavasti. Here also, Matchigam 200 ml. In the earlier yoga, we took only 100 ml. Here it is 200 ml. Levanam 15 gram, Sneham 200 ml, Madhyashtiadi Dailam, Tiktaka Dailam, Tiktaka Krdam, Sugamara Krdam, etc. Or Kalkas of Sadahua Kalkam, or Kwadams like Guduchadi Kashai. It is of Raktaja Janyanetha Rogas, Raga in the eyes, Abhishandam, Akshipakam, can be used in conjunctivitis, uveitis, and other inflammatory conditions. It can be used. And before Purvakarma and better dietary regimens also to be suggest or also to be teach the patient after the Guluchadi Yavanavasti. Next comes Baladi Yavanavasti. Here Matchigam 200 ml, Levanam 15 gram, Sneham, Kalyanagakardam or Shirabaladailam. And here we are mentioning Snehas. This here it is mentioned Kalyanagakardam or Shirabala. Depends the condition, one can use Jivandyadikardam or Mahadiktagakardam. Depends the nature of the problems. It is the choice of the Vaidya. Kalka it is of Eshtimadu, Padam it is Bala, Atibala, Atmagupta, Apamarga, Yavani. Bala it is Vadapitta Shamanam, Belyam, Brahmanam, Raktapitta Shamanam. Adibala it is Vadakaram, Belyam. Atmagupta it is Tritosha Shamanam, Vadaharam, And Apamargam, it is Kapha Badhaharam. Yavam is Anabhishanti, Agni Vardhagam. Ksheerabaladailam, it is Padavittaharam, Velyam. Kalyanakritam is Dosha Samanam, Velyam, Brahmanam, Anilomanam, and Medhyam. Many Netra Rogas like Timiram, Akshishulam, Akshisravam, Abhishandam, Adimandam, many of the conditions it can be used. Balagudichadi Basti next. Here also Sukumara Kritam, Kritam, that is Machigam, Levanam, Sneham, Kalkam, Kwadam. In that, in addition to that, we are adding Ajamam Sarasam also. That is about 150 to 200 ml. Make a decoction and the rasas taken out from the Ajamamsa, that also can be used here. It is Velyam as well as it is much rasayanam also. Machiga quantity, it is of 200 ml. Levana, it is 15 gram. Sneham, it is 300 ml. Sukumara, Sahajaradi Dailam, Sukumara, Krudam, and Kalkas Lake, Yavani, Madanaphala, Villum, Kushta, Vacha, Sadahua, Musta, Pippeli. Sorry, some of the things are repeated. And Quadas like Balamula, Balagulichadi Gadam, Trifala, Rasna Kwadam, Rasna Dasamula Kadam, etc. can be used as a Kashaya Dribya. And Sukumara Kradam, it is the Dosha Samanam, Anilomanam, Sahajaradi Dailam, it is Vadavitta Samanam. As I told you earlier, all the Kradas or all the Tailas are not advisable here. Only one Kradam, Kalkam, it is of everything. And the Kashayam, only one Kashayam, and the Mamsarasam. So it is not Balagulichadi, either any one of the Kashayam according to the condition of the patient. Basti in Netaroga. Next comes Balamula, Niruha Basti, Machigam, Levanam, Sneham, Baladailam or Dhanandarandailam or Shirabaladailam can be given, or Kalkas Lake, Ashwagandha, Devadaru, Sadahua, Quadas Lake, Balamula Quadam. Here taken the Dhanandarandailam due to Vatapitta Shamanam, Velyam, Brahmanam, Rekta Prasadanam. Vadaniromanam is required in Netra Chigilsa. Pitta Samanam is required in the Netra Chigilsa. Velyam it is required, and Brahmana it is required in many of the degenerative as well as genetic disorders. Rekta Prasadanam happens, then only the proper Drishti Pravartana. And earlier I mentioned some Kashaya Basti yogas, now some and the Anuvasana Basti yogas, Madhyashtyadi Taila, Matra Basti can be given in Vatapitta Samana as Belya, Brahmana, Rekta Prasadana, and Gandharva Hastadi, Air and Tailam can be Matra Basti can be given in for Anulomana purpose, Deepanam, and those who are of more of Vadiga in nature, and Krura Kosta. Nimbamradadi Aranda, Taila, Matravasti, those who are of Pitta Prakriti, and it is of Tridosha Shamana, Rekta Prasadana, and Rektacha Chanya Netra Rogas, it can be given, and it is of Jivana in nature, and Srodo Shodana, Urdhvajatru Roga Hara, and Jivanjadi, it is Tridosha Hara, Velya Brahmana, it is a Jivanjadi Kridam. It is mentioned in many eye elements. It is Chachushyam, Jivandi is Chachushyam, Krida, it is again and the Chachushyam. the combination that helps to enhance good health to the eyes, the surrounding organ areas, and it is valya to the chachu. Next, I am dealing about some of the netra nasya medications in many of the netra rogas. Navanam, avaviranasyam, mavananasyam, dhumanasyam, marchanasyam, pradimarchanasyam, etc. So navanam, instillation of sneha, is of two types, sodhana and shamana. Instillation of paste of the juice of leaves or fruits are used. It is using it for the shodhana purpose or stambhana purpose. The juice of Drona Pushpi can be used in the management of Adimanta. In angle closure glaucoma, it can be used. Some Churna nasyas also can be used in angle closure glaucoma. Kushtam, the Churna, it is made out of Kushtam, Vasha, one pinch of Saindavam together. We can use it as an Avipedaga nasyam in Adimanta. And there are other Stambhana nasyas. If blood oozing or some secretions coming to the mouth and nasal dripping, Shodhana is good, but in many of the conditions, immediately Shodhana cannot be possible. There also some Stambhana Aushadas can be used. If nasal bleeding happens, the bhasma, we can use it as a Churna nasya, small quantity of bhasma. That means that is cow dung powder. Cow dung, not cow dung, fried powder can be used. Bhasma, that is bhasma, can be used as a nasya drivya. That helps to arrest the nasal bleeding in a small quantity. Installation of powder medicines into the nostrils using in many of the eye disorders. Dhumanasya medicate after the nasya, the dhuma can be given to patients. Marsha, the quantity of medicine, it is more than that of a pradimarsha. Here using 8 to 10 up to 14 drops of medicines instilling through the nostrils. Pradimarsha can be given at any time. We are using only 2 drops of medicines, and there is no specific kala mentioned for Pradimarsha 2 drops nasya. But for the marsha, it is mostly in the morning hours, the kapha kalas. In Vadaja Netrarogas, Stira Kshira, Madhura Taila or Madhura Taila can be used. In Pittaja Netrarogas, Kshira or Sarpi can be used. In Kaphaja and Netrarogas, Maricha, Shikru processed Thailam can be used. There are some conditions where we can adapt nasyas, Krishronmilam, Praklinnavatmam, Pakshmakopam, Kapotklishtabashmam, Pashmoparodham, Achagajadam, Patmasarkara, Sukra, all these conditions for them. Nasya can be given. In Krishronmilna, there was Nasya with the Purana Sarpi. And the Sarpi, it is made out of Draksha and Sarkara. It is mentioned in Vakvada. Praklinnavatma, the Krida, it is mentioned, processed with the Sringaveram, Suradaru, Musta, Shigru, Marija, etc. In Pakshma Kopa, Abhishyandokta Nasya can be Abhishyandokta Hara, Aushada Nasya, Triphala, Yashtimadhu, manjishta, processed kridam or tailam can be used. Kapot klishtavatma, kapahara dravya nasyas can be used. Pashtmogora tikta nasya can be padavala, nimba, arakuda. So tikshna nasya can be used. Achagajadam shira sarpi nasya can be given. And vatma sarkara and shukra krida nasya can be used. And in Vadaja Bhishanda, Stira Shira Madhuradaila is good. In Pitaja Bhishanda, Shira Sarpi is good. Kaphaja Bhishanda, Nasya with Tikshna Trevyas. In Kaphaja Bhishanda, Palasa Kritita, Pishtaka, Praklinavatma conditions. Kadam processed with the Sringiveram, Turadaru, Musta Chigru is good. And Shushkachivaga, Jivaniya Kradam or Anudailam or Hanundaram Thailanasam is advisable. Jivaniya Gana Siddha Thailam is good. Raktaja Vishanda and Adimanda, Sashova Ashova Netra Bhagas, Vaidejanika Nasya with Shira and Sarpi is advisable, and Pitta Vidakta Drishti and Kapha Pitta Vidakta Drishti. We can use Sarpi processed with til Sarpi, Tilloga Sarpi can be used. Kapajati Miram, Go Sagar Kwada Taila. Go Sagar mix with the water, the clear water to be taken, and that it is processed with the Kaphahara Dravyas can be used for Kaphajatimira conditions. Usira Lothradidailam also can be used in Kaphajatimira conditions. In Pittajatimira, Kevala Krida or Kagolyadi Gana Siddha Kridam, Aja Aviga Krida also good. Vada Raktajatimira, Anudaila, Kagolyadi Tailam, Siradi Tailam is good. Vada Jatimira, Saha Shravari Tailam, Trivutili Tailam, in Timiram, Kajam, Linganasham, Divanthyam, Naktantyam, etc. Nirpallavadi Tailam can be used. Mahapipali Tailam, it is mentioned in Vangasena. Next comes Rakta Mokshanam. And it is of two types, Shastra and Ashastra. So Shastra, Stiravedam, Prachanam, etc. with the Shastras, and Ashastra with Srangam, Alabu, and Jaloga. Most of the Netra Rogas are Lehana Satyas, especially blepharitis, spring kata, follicles in the lower of the eyelids, etc. can be treated with Lehana Karmas, and that Lehana with Japakusumam or Samudra Phenam. These are all easiest. Spadiga, much care is required while doing the Lehana Karma with Spadigam. But Samudra Phena, it is easier. Japakusuma, if with the experience, it gives a good result. That is, the patient comes with a purulent discharge from the eyes and the limbal congestion. In those conditions, the follicles which is present inside the eyes to be cleaned with the Lehana procedures. Before doing the Lehana, some Murdu Swedanam also to be done. Swedanam and the first few days of Snehapanam, either with the Tiktaka Kritam or Mahadiktaka Kritam or Kalyanaka Kritam. Mainly the Tikta Rasa Aushadas are more good. Siraveda and Prachana is indicated in Sirotpada, Siroharsha, Sashopa Pagam, Ashopa Pagam, Anyado Vadam, Uyalasam, Vada Pariyam, Adimandam, Abhishandam, etc. Jalogavacharanam is contraindicated in case contraindicated cases of Stiravedha, especially Raga Prapitimira. Paschat karma in Nether Rogas. Payadi Kramas enhances because after the Panchakarma procedures, Payadi Kramas to be followed, and that enhances the formation of pure Rasa Dhatu that to reach the eye and completes procedure of Shodhana. Only after proper Shodhana may other therapies be prescribed for Murtadaila, Tarpana, Podavaga, etc. So, Panchakarma can be given. That is not the main treatment, but it is the main treatment. Make sure the doshas are expelled, doshas are expelled from the Urtajatrus, then one can proceed for the Murtadaila or Tarpana or Podavaga. Paschat karma of Basti, laying in a supine position, Snana, Payadi, Samsarjana Kramas, these are all, I don't need to explain all those things. And manage the, in Basti, Yabat, chances are there. So manage the specific conditions with if Basti Dravya, it is not coming out proper, next Basti enema to be given to proper elimination of the Basti Dravyas from the purifies. Paschat karmas of rectal moshna, the site is washed and with cold water, and make sure the further bleeding it is not taking place, and clean that area and cover that area with laksha churnam, or if more blood passing is further happening, some Shida Upacharas, if it is required, that also to be adopted. Panchakarma in specific some ocular diseases. Here mentioning some vascular pathologies like diabetic retinopathy, vascular occlusions, ELS diseases, macular edema, subretinal fluid, CSR, many some vascular conditions. Shonita Chikitsa according to the Charaka Samhita, Virejana, Upavasa, etc. Yavanavasti, Samsodana Chikitsa, Rasayana Chikitsa, managing Avarana and including Avarana and inducing Anulomana. So in these conditions, first thing, the Deepanam, Vachanam, which dosha it is involved, understand that one, and if after the proper Snehana Aushadas, do the proper Virejana in the diabetic retinopathy or vascular conditions. Virejana it is Agriya. So here the medicines like Padoladikradam or Padola Muladikashayam can be given. Basti also is advisable after the proper Snehana Basti. Then the Basti that is with the Kashaya made out of Padamula Muladikashayam, that Kalka may be, and Vasha Kalkam or Estimadu Kalkam or Trifala Kalkam can be given. And the Sneha Dravyas includes Madhyashthyadi Thailam or Padavaladi Kardam or Mahadiktaka Kardam or Gulgulidiktaka Kardam kind of medicines can be used in the conditions in vascular pathologies like diabetic retinopathy or other vascular occlusions. Next, other some degenerative conditions. Here the conditions like ARMD or other neurodegenerative occlusion or retinitis pigmentosa. Here also, after the proper Deepana or Vajana, the Snehana Dravyas to be given first. That Snehana like Vidaryadhikardam, Panchadiktaka Kritam or Padavaladi Kritam for Snehavana. And once after getting the proper Snigdhada to the body, proper Videchanam, then elimination of doshas from the Urdhvaja through Nasya, and then that Brahmana Bastis also can be given. Brahmana Basti, the main good thing in this, the Rajayavana Basti, it is good thing. Balaguruchyadi Basti, etc. can be given. And these are all the preliminary treatment in the management of ARMD or other neurodegenerative ocular conditions. After this, the proper Samsarjana Krama, Vayadi Kramas, you should adopt some Rasayana Aushadas, nutritive therapies, the medications, which is helpful in the management of degenerative condition, that to be given orally. After the proper elimination of the doshas, if you give its medicines, its effect will become more, or otherwise sometimes that leads to which all the Rasayana Aushadas giving, it will not working its proper way. So after the Shodhana Kriyas, start with the Chakshuksha Rasayana Chikitsa. And also the Kriyakalpas also can be adopted here. Kriyakalpas like Ashchodhanam, Nasyam, Ashchodhanam, Tarpanam, Pudavagam, and that Pudavagam also, that also of Jivaniya, Gana, Siddha, Pudavagam. Here also the Mamsarasas are adding. And there are some specific Chakshuksha Rasayana Aushadas are there. Especially Anjana or Ashchodhana made out with goat's Yagrt Pippali Rasayanam can be given. It is not for daily use, few days of use, 1 week. Other some autoimmune conditions, uveitis, scleritis, conjunctivitis. Here the dosha, it is predominant dosha is Pittam, Kapham, ultimately Vadam also. Here also the Amapajanam is required. The doshas are already lodged in the Urtajatu. It is lodged in the Chakshu. Need to eliminate it from there. Happened in the Chakshu is happened. Other things. It is ongoing process. So proper Shodhana. And also the Shodhana directly from the eyes. Raktamoshana or Jalukavajara, etc. can be given. And Amapachana is the first to alleviate ama in both Netra and Koshta. Snehanam is required. And anti-inflammatory medications to be used for the Basti therapy. But here the Shamana Ushadas also plays a major role. And the Nasya, it is good line of treatment in the management of many Kapha predominant Netra Rogas. Here the Varanadi, Kashaya, Sitra Kridam is good to alleviate the avarana of Kapha. And these are all some other conditions like retinitis pigmentosa or corneal and macular dystrophies or other genetic neuropathies. Here also the Padola Siddha or Tikta Kasha Tikta Rasa Siddha Kradavanam to be given, and Chakshushya Aushadas. And here the medicines we can use, which all the things mentioned in the Kushta Chikitsa medicines, or which all the things mentioned in the Pandu Chikitsa, or some of the medicines mentioned in the Shitra Chikitsa, etc. can be used for the Snigdhada purpose. That Snigdhada, once after attaining the Snigdhada, After the proper shodhana, they can start to give some rasayana therapies. That rasayana aushadas also, it is purely 100% rasayana, not like that, which is chakshusha rasayanas, and that it is processed with the triphala or tikta rasa aushada can be given. And also the alleviated dosha in the Ursajatru can be eliminated through nasyas. And nasya, it is with the Bindudaila nasyam or Shat Bindudaila nasyam or Varanadi Chira Siddha nasyam. And the glaucoma, it is another serious conditions. Here also Amapachana, that reduces ama and lowers intraocular pressure and removes avarodha. And here also the Snehavanam, proper Virejanam, Nasyam, and other shodhanas can be adopted here. Shodhana, Madhudailika Basti is adopted, it can be adopted here. And Madravasti with Madhyashtyadi Tailam, Madravasti with Pipalyadi Sevyam. Proper shodhana also need to happen here. So after Madravasti, the Kashayavasti given, some of the Kashayavasti yogas already I mentioned. And here I am concluding my presentation. And this Panchakarmas fulfills the deep prayojana of Ayurveda, that is Swastasya Satyarakshanam as well as Adurasya Vigara Prashamana. It gives a proper purification, and root cause of the roga is eliminated by proper shodhana. And Panchakarma is the Pradhana Karma, Pradhana Chikitsa of Netra Rogas. It is Pradhana Chikitsa, but Purva Karma and Paschat Karma are also Pradhana in many of the conditions. Why I am repeating it? Just finishing Panchakarma and leaving like that, it is not sufficient enough to cure the problems of the Netras. So, Pradhana Karma, and it is Pradhana Karma, Shodhanam, always it is Pradhana Karma. It has got its own significance, but after that, proper Samsarjana Kramas also to be adopted. Aharam, Viharam, etc. are significant as Samana, Brahmana, and the nutritive aspect. A blind person can't see, enjoy the beauty of the world. And for the restoration of the health or to improve the quality of vision, Panchakarma plays a very significant role. With this, I am concluding. Thank you for giving such an opportunity to present my views in front of you. Thank you once again.
Thank you so much, sir, for sharing your experience and your insights on this topic. Anybody who has any queries can either put their queries in the chat box or ask sir on the platform. Switch on their mics and
नारायण जी बहुत बहुत धन्यवाद, बधाई आपको, बहुत सुंदर आपने व्याख्यान दिया। बड़े छात्र हमारे शिष्य बड़े प्रभावित हुए आपके व्याख्यान से।
Thank you, sir. Thank you. Namaste.
अच्छा आपने व्याख्यान दिया पंचकर्मा पर, अच्छी तरह
Thank you very much for your comments, sir.
और ये बहुत अच्छी श्रृंखला चल रही राष्ट्रीय विद्यापीठ की, तो बड़ा हमको इंतजार रहता है। अच्छे अच्छे उद्बोधन सुनने को मिलते हैं राष्ट्रीय विद्यापीठ के माध्यम से, और बड़े छात्र प्रभावित है आपके व्याख्यान से।
Thank you, sir.
एक और बार वो भी हुआ ना, शासित हुआ, बात थी 4-5 साल।
धन्यवाद अच्युत सर। और किसी के कोई प्रश्न हो किसी भी शिष्यों के तो हम ले सकते हैं, आप हमें मेल भी कर सकते हैं. So with this, on behalf of the organizing committee, I would like to thank Narayanan Nambudri sir for sharing his views on this topic, taking out his valuable time from his schedule. I would also like to extend my gratitude to all the gurus who have joined us here today. Our mentors, Padma Bhushan Devendra Tribhunaji, President Governing Body Member, Director Dr. Vandana Siroha ma'am, and Secretary Ministry of Ayush, Shri Vaidya Rajesh Kotecha sir, for their constant encouragement and motivation in all our endeavors. My heartfelt thanks to all the Shishyas and other Ayurvedic scholars who have joined in here today and with their participation made this webinar a successful one. Last but not the least, I thank each and every member of Rashtriya Ayurveda Vidyapeeth from our back-end team who have been working to make the on-stage event a successful one. Our next session will be on 24th October 2024 by Dr. Akhilesh Shukla sir, who is the Associate Professor at All India Institute of Ayurveda, Goa campus, dealing on the topic spirituality and Ayurveda. So hope to see you next Thursday. Thank you all. Namaste.
Thank you, Dr. Pooja, and thank you, Vaidya Achyut Tripathi sir.
Thank you, sir.